Good evening, and thank you for joining us for another Formfast educational webinar. I'm Aaron, Marketing Manager at Formfast, and I'll be your host. Today's online event is entitled Maximizing Case Management, and will feature Andrea Frazier of Andrea Frazier and Associates. But before our event, there are a few housekeeping items to review. First, we encourage you to share your questions and thoughts and opinions throughout the webinar. Please send them in either the Q&A or chat panel on the right side of your screen at a time during the presentations. Second, note that the video for the session will be broadcast through your computer speakers. If you are disconnected from the video broadcast or having other technical difficulties, please send a message to the host so we can approve you to join the teleconference. Once connected to the teleconference, please make sure your computer speakers are muted, otherwise you might experience an echo. Also note that today's webinar will be a little bit shorter than previous webinars at around half an hour. And I'd like to introduce today's speaker, Andrea Frazier. Andrea is a healthcare professional with over 28 years of experience in managed care quality, medical management, and case management. She's the founder and CEO of A. Frazier and Associates, LLC, an independent medical management company dedicated to case management and utilization review services. And is also a certified case manager, a certified professional in utilization review, a certified managed care nurse, and a medical legal consultant. She is an assistant professor and faculty advisor for Wood University, and formerly with Washington University School of Health Administration, where she taught quality improvement, health management, healthcare legal services, and organizational behavior to graduate and undergraduate students. Most recently, Andrea received the Case Manager of the Year Award for her local chapter of the Case Management Society of St. Louis. Pleased to have Andrea join us to share her insights on how case management can be improved in hospitals today. Following Andrea, our Director of Product Management, Sean Curtis, will join us to share some of the solutions we at Formfast have created to transform case management. Many of the benefits Sean will speak about are made possible by the new features in the next version of our FastFlow platform, which we are launching next month. This time, I'd like to turn the presentation over to Andrea.
What I'd like to share with you today is a discussion that involves case management and the venues that case management encompasses. According to a definition, case management is a collaborative process that assesses, plans, implements, coordinates, monitors, as well as evaluates the options and services required to meet the client's health and human service needs. That is a mouthful. But truly, case management in a philosophy is an underlying premise which is based on the fact that when an individual reaches the optimal level of wellness and function capability, everyone benefits that. The individual being served, their support systems are in place, and healthcare delivery system and various reimbursement resources have been satisfied. Case management is defined by advocacy and thorough and complete communication, thorough resource management, and it promotes quality and cost-effective intervention as well as predictive outcomes. Management is a practice that includes a combination of interaction with patients, social workers, physicians, home health services, various practitioners at various levels, and the efforts of the community as a whole to, again, have great resources in place to reach this optimum level of health and wellness. Case management is used in utilization review. It's part of the discharge planning process. It proactively identifies and prevents delays in patient care. A measurement for case management and its outcomes is not only managed, evaluated, and cost dollar savings are put in place to ensure that they are achievable goals. Denials for days for delay of procedure as well as discharge are eliminated, and clinical documentation of the appropriate DRGs are assured, as well as any issues with risk management identified. Management settings include that of hospitals, insurance payer companies, private corporations, again, managed organizations, home health, behavioral health entities and agencies, independent case manager companies and management companies, acute and subacute rehab centers, as well as long-term care settings. So those are the variety of venues in which case management is used and case managers are necessary. The philosophy of case management is that it is a specialized practice. The case manager facilitates as well as promotes health to their clients. It allows direct communication among the patients, physicians, professional services, and payers. Case managers collaborate with all service levels. The case manager links such care to clients and the appropriate providers and resources throughout the health and human service areas for various care settings. Case managers also ensure that case management is provided in a safe, effective, client-centered, timely, efficient, effective, and equitable fashion. Case managers benefit the hospitals and the payers. Let's discuss that, and it is as following. As healthcare cost climb and cost containment becomes essential, the case management emerged, and the case manager became an integral mean of resource within the hospital to address patient needs, also to identify the use of viable and effective community resources. In cost-effective ways to facilitate the health of the client, savings for the insurance companies became almost mandated in the promotion of the highest level of health functioning to their clients. This optimum value for clients and reimbursement resources for providers and facilities across the healthcare continuum, and the availability and cost-effective delivery of efficient services that make case management a benefit in all of the sources of either the payer realm and the hospital and rehab system. The advances in healthcare technology combined with the diminishing resources increase the demand for case management. So it's absolutely necessary that case management be introduced to each one of these areas. Management also assists in the process of measuring and assessing risk as well as developing strategies to manage that risk. Risk means high dollar costs for case managers. Let's talk about the factors that impact case management. First of all, there's been an explosion with regard to managed care organizations throughout the United States. This explosion is mandated not only through case management needs at the individual employer realm, but also with those Medicaid and Medicare employees, their recipients that use managed care structure in order to meet the needs of their clients. Increasing numbers of chronically ill patients have also been a direct need that would impact case management. Maintaining the newly developed mix of drugs that are required in complex as well as ongoing case management is optical for great care. Not only that, but the state legislation as well as federal require licensures and certifications in the fact that all case managers will be required for hospital systems and payer sources where there is a federal dollar that is used. Case management legislation is smacked throughout the Obama plan for health care that is in the forefront. The scope of case management includes, again, federal, state, and local regulatory agencies with regard to compliance. The Commission standards for compliance also outline the responsibilities of case management. Medical documentation systems require skilled and savvy case managers. Core measures for utilization review as well as compliance to those utilization review matters are also a part of the case management scope and responsibility. Patient safety as well as compliance with regard to the reduction in hospital-acquired infections and or risks that occur while in the hospital. Clinical guidelines, pathways, and evidence-based practices need to be very evident within the scope of case management responsibility. Quality improvement standards also reflect case management responsibilities. Organizational and financial performance with regard to length of stay, the cost per case, the management of your institution, as well as managed care companies, clinical practice improvement, evidence-based and clinical practice guidelines. case management best practice standards and development, as well as case management competency, and lastly, utilization management. Responsibility of a case manager includes that the case manager must learn to balance the needs of the patient with the institutional goals and practices that are in the forefront of everyone's mind with regard to payer and hospital delivery. Cost and conflict arises when there's a clash between the values of case managers, patients, physicians, and the facility. Managers serve as the go-between to make sure that there is great communication and that any risk is mitigated. Negotiation of rates for services using special care agreements for cost savings for hospitals as well as insurance company is a responsibility and used quite frequently in the realm of case management. When we look at quantifying impact of case management in the hospital sector, we look at case managers and their ability to impact the reduction of readmissions, to decrease the length of stay, to impact any unavoidable days with regard to delay of treatment. Indeed, the patients are staying over their length of stay during the weekends, holiday stay, as well as trying to implement or bring in the outpatient diagnostics in a timely fashion to make sure that there is complete, total, and patient care given. There are increases usually in physician satisfaction that work hard with the case management sector. The index mix with regard to complexity of cases are streamlined through the use of a skilled case manager. Admission services are typically reviewed by case managers and also have quantifying impact on case management and hospital outcomes by the reduction of those services that are not properly identified as being approved. It can show both hard and soft savings. Now, when we talk about hard savings, we reflect on budget or performance issue goals, and those are types of hard savings that directly to decrease in expenditures. So hard savings are ultimately equivalent to case management activities. Examples would be reduction in payer denials, decrease in unavoidable days. Soft things would be those things that are indirectly linked to case management, like lower admission rates or post-op complications, and these things can ultimately be considered into hard dollar savings. Things can be realized with increased dollars spent in productivity resulting from automated processes and improvement processes for case management. When we look at legislation, obviously we look at Medicare and Medicaid centers and conditions of participation of those centers. Hospitals must have utilization review plans to provide a review for all the services furnished by the institution, and by that includes case management. Quality review and quality control and improvement also have assumed binding review of the hospitals. Hospitals must have utilization review committees, discussion of medical necessity denials and unavoidable days, as well as quality of care issues are reviewed, and all of these fall under the case management realm. Update to the U.S. plans per hospital policy. Hospitals are required to have utilization review plans which encompass case management in place, and the hospital must have, in effect, a discharge planning process that applies to all patients, in which case management is intimately involved. The hospital's policies and procedures must be specified in writing, and each facility has its own discharge planning policy and procedure. These are all responsibilities that fall under the case management role. Again, case management is a collaborative process that includes assessment, planning, facilitation, coordination, evaluation, and advocacy for optimum outcomes to be achieved.
Thank you for that presentation on management. My name is Sean Curtis, the Director of Product Management at Formfast. I've worked with Andrea and several other case management professionals to develop a solution based on the Formfast products and technology so case managers work more effectively and more efficiently. First, to introduce Formfast as a company. We have a broad base of customers across the United States and internationally. we're considered a best-of-breed product, enterprise workflow and forms automation and forms management solutions for hospitals. Specifically with hospitals, for nearly 20 years, solutions are integrated with all HIS vendors and most of your applications that you use in your organization, focused on process improvement. So Formfast. Real partners in improving the business of healthcare. We've been there of workflow automation technologies to hospitals in the U.S. for nearly 20 years. We're considered best of breed in the areas of forms automation, workflow automation, and enterprise workflow. We have 850 customers internationally, growing strongly. Our solutions integrate with major HIS vendors as well as HR systems, clinical, other systems that you're using in your hospital. Focused on process improvement. So again, partnering with you to improve the business of healthcare. What Formfast a little bit different than everyone else? This is really one of our main differentiators here. We have a vision for your hospital. We have worked with hospitals over time to develop products that are taking hospitals to the next step. We have this maturity model going now is basically the roadmap to success, roadmap to automation. At the bottom of this pyramid, we've got what we call the paper-heavy stage, where you have a lot of paper. People are filling out paper forms. They're stamping or embossing or labeling paper documents. Help you automate that. That's where we've been. That's what we've been doing for many years. The next step is to go to a paper-light process where you can eliminate that paper, automate it, turn it into eForms, make it print on demand, eliminate all the problems of obsolescence that you would have with your pre-printed paper forms, using embossers with illegible stamping, which is often the case in that scenario. And then at the top of the pyramid, we have the stage 3, which is paper-free. It's also where we talk about a fully integrated solution, a system where we're breaking down the silos and we're automating things that cross these gaps, where you have an application that's specific to that application and that one area, but you need to also communicate with other areas, and that's where we fit in, is to merge the gaps or fill in those gaps between your applications. We have solutions in several areas, including in this case the case management solution. We achieve this for our hospitals. This is a little bit about our tool set that we offer. At the top right, we have automated workflow. This is where we can take your processes that you have today that probably are in paper, so where you're messaging from one person to another or making requests or asking for approval. Any type of form that you're filling out by hand, basically we can take that, turn it into an electronic form and automate that, put it online, and share data and collect data. To the left of that, then we're talking about forms on demand and electronic signatures. This is where we're talking about reprinting of forms with patient information on it. So you can go in at the nurse's station, and as you need documents, as you need patient documentation, you can select your patients and select the forms that you want printed. That's going to merge data and print out that packet of forms right in there. No pre-printed forms and no labels and no embossers. So that's what we're talking about with eForms on demand. No inventory, no obsolescence in your forms. And with that is our electronic signature solutions. So now we can talk about collecting electronic signatures at the time of consent, at time of registration, at bedside. Anytime you're collecting signatures on forms and documents, taking that to the electronic signature technology means less printing, less time indexing, less time finding those documents. They get directly integrated into your EMR, your archiving system, so that it's available as soon as that patient signs that form, and that documentation goes into the EMR automatically. When you need that evidence that the patient has signed the paper, it's there right away. You don't have to wait. You don't have to call down to registration and find out if that's available. And down at the bottom of the circle here, we have the print management. One of our most powerful tools. It's really happening in the background. We figure sets of documents that need to be generated upon certain things that happen in your organization. So a big example of that is at admissions time. a patient comes in and they're admitted, we can evaluate what type of insurance they have, whether they're Medicare, Medicaid, whether they're a patient under 18. And we can generate the proper forms on demand so that in the background these are printed out and ready for use. At the same time, we're sending that information over to your EMR, to your imaging system, so it's there as well. So you can have your information available in both places in real time. Another benefit of this is being able to put dynamic barcodes onto these documents as they come out of the printer. So we can barcode onto a form what the patient is and what the form is, so that since it became a printed form, if you fill that out, all you have to do is stick it onto a scanner, scan it into your system, and those barcodes are going to be recognized, and that form will be indexed into the right patient's folder under the document type based on those values in the barcode. So it's very powerful as you move into this electronic medical records. So fast for case management, we really take these technologies that we talked about and then we apply that. We take data management, we take the workflow technology, we add analytics, and we add messaging, apply that to our case management solution. And that gives you the bits of a fully automated solution that you reduce denials, lower your risks of future audits, and measure and improve staff effectiveness. And of course, it's going to help you improve patient care and satisfaction. And now how we do that? Some of the features that we offer in our case management solution include the intelligent work list for individual case managers. This gives your case managers the ability to come into the place and have a work list that is helping them work. So it's showing them flags, it's highlighting different things that they need to know about a patient so that they can plan their workday more appropriately and make sure that the patients are getting the care that they need. And this links that care information in related processes. So as they need to go in and do based on what this dashboard is telling them, they're transitioning that data into new processes and starting that process and also following through with it with automated workflow. Another solution is that we can automate your payer communications to ensure that you receive your full reimbursement by ensuring that the payers receive full, accurate, and timely information, and that will reduce your denials. The nature is the analytics that we offer. So now as we have encapsulated all of these features and these functions into one dashboard and one set of documents and one set of collection devices here, we can get information and now we can start to visualize your data to help you identify your trends and understand your performance and start working towards improvement. Another feature is that we allow you to track and manage the claims and the denials. So just managing your patient through the hospital stay, but also the communications with your payers and the claims that are related to that. It allows you to work with the denials. Allows you to arrange physician reviews, peer-to-peer sessions, peer reviews, and things like that. It'll help track your avoidable delays and your avoidable dates and what causes those so that you can track those down and stop those from happening or pinpoint where they're coming from. It gives you a single view of the cases so your case managers have access to payer authorization information, the right contacts at the payer, all the claim information, and it assures that your claims and your timelines are not missed. And again, the tool guides your case managers through the process of case management. So what does it all look like? This is a shot of what the dashboard looks like. This is a work list dashboard, so you'll see that it has, basically your patient census. And this is filtered by users. So the person who's logged in is going to see the patients that they're responsible for. They're going to see and have the ability to track this patient through the facility, through their care cycle. If we look a little closer at this, we see that a couple of the fields are highlighted in red, and this is the flagging that we can do based on your business rules. We set up so that based on the information that comes in, we can see that this patient has been in the hospital for 5 days, an approved length of stay of 4 days. So we're going to highlight that in red so that we can do everything we can to get case management team to move the patient out of the hospital or qualify this patient for a longer stay. Another there is in blue that shows that the anticipated discharge date is today. So that would, independently of the length of stays, that would prompt them to do what they need to do to close out that patient's stay. Of course, all these column heads, all these tables are customizable. And once you get this view, then it's also sortable, so you can sort by column heads, you can sort by admit date, you can sort by discharge date or length of stay, or facility or diagnosis or whatever information we want on this. And then it's sorted out so that you're not inundated with all the patients in your organization, but rather you're seeing just the patients that you're responsible for as a case manager. And as work lists, we're going to be able to launch into processes related to each of these patients. So we can launch to the claim status. We can open different documents that give us a view of what's going on in this patient. So this is just the tip of the iceberg. Being able to view kind of your top-level information about each of your patients, and then being able to dig to that patient's information, start new processes without having to rekey information, rekey data. It takes data and starts processes based on this patient, this stay, and this encounter. One of the most important parts about this, and the best way to get your process improvement out of our tool, is to take this opportunity and collect this data into our system, because really what we're doing is taking the things that you might have been doing in other processes across different systems, and especially in paper or on forms or in notebooks. We're taking that information and we're capturing it. So we're giving you the ability to make electronic forms that capture that data, store data in a way that now you can report on it. So you can report on things like length of stay. You can narrow this down by physician, so you can understand what physicians are behind different length stays or maybe different underlying conditions. You can see reports on your denial. You can see your avoidable days. You can see the cause of delays. You can see the cost avoidance and the interventions that your case management may have had to lower your cost or lower your risk by moving patients from inpatient to observation or observation to inpatient as that's appropriate. We also leverage our output management technology to help you communicate better with your payer community. So we provide you the templates to communicate with your payers, status updates. Some contracts dictate timelines that you have to communicate with your payers, whether it's 2 days or 6 days. We can do a couple of things around that. One, we can put in on the work list a flag that says, okay, it's been 6 days. You need to send more information to Department of Social Services. Or you can automatically flag something for each individual payer that is in your payers list. We can also automatically email or directly fax to your payers out of our system. Give you the ability to put that template with the information that you've already collected, and if there are any gaps in that information before you send it to your payer, so that you're assured that you're sending them all the information they need to validate this claim so that you get your reimbursement. In addition, there's always those outlier conditions where you need some kind of a form here or there. We have a library of forms that are related to the case management. So as those outlier conditions come up, you take that form and start a workflow around that condition. So you can do things like messaging to services, and that is into workflow. Workflow is the core of this whole product. Workflow may be just opening a form and filling it out. It may be open that form, filling it out, and that one would go to a physician or a scheduling system to schedule peer-to-peer review. So now we're talking about being able to fill out documents and move content between people, or just putting content into a database so that you can use that in your communications with your payers. So we give you the ability to do messaging in your case management, your physicians, your labs, your therapy units, your post-acute care, anything that's related to case manager being able to do their job. We can automate that type of communications around our workflow engine, and handles everything online, digitally, electronically, in real time. So that can be things like scheduling P2P, peer reviews, patient transition documentation, utilization review processes, district planning, dealing with social services, and even within social services, the portions of case management that group does have a lot of processes around as well. So you can see we're kind of really taking everything that we have over the 20 years that we've been in business and working towards these types of solutions in hospitals. So applying that knowledge, applying the technology in various ways, and then bringing it all together through a dashboard to give you your work list, your analytics, your process improvement, and the ability to just do things better and improve your business. So with that, I'm going to stop there. We've got a few questions that have come in. I'm going to start off here with a question and answer session. Andrew, most of our audience here today is from hospitals. So in your experience, what do you see that hospitals could be doing better around case management? What could help them do better? What would advice be for case managers?
They could be proactive to identify those cases that needed pre-certification, to identify those that have outstayed their length of stay, that problematic or discharge planning issues with regard to placement, or perhaps to those kinds of levels of care. And we have a patient or a client in a certain level of care that did not meet criteria in that particular venue. This particular tool has identified the fact that they need to be moved to a different level of care, and certainly could be instrumental in that proactively identifying those issues with regard to length of stay as well as appropriate care setup.
What would be a good measurement of how your case management group is doing in a hospital?
I think that has to do with your length of stay reports that come out monthly. Any of those patients that have stayed after a period of time. From the payer source, I do know that payers look at a monthly report that says who has fallen from this month over into a length of stay of next month. What kind of length of stay issues are we dealing with? Again, I think that it could be very, very useful in identifying those patients that have stayed past the length of stay, as well as those that have become chronic repeaters, frequent flyers, those kinds of issues that need to be attended to that require complex case management.
As a hospital, in your experience, what do you see as the leading source of denial to hospitals and their claims?
Length of stay would be one issue. The patient has exceeded their length of stay, and or there's been a delay of treatment. That's called a carve-out. In other words, the patient has been there, the length of stay or the disease process has been approved. However, there's a delay in treating that process. Those days are denied. We identify those patients and what necessary testing and or diagnostic is required would give the case manager a heads up as to scheduling issues. Other issue is with regard to exceeding their length of stay. That means that discharge planning has not been properly identified, and so discharge has not been implemented as a result of collaboration not being there to effectively discharge the patient. I think that this tool supplies a great opportunity when initial length of stay is loaded to give the case manager a heads up that discharge is pending, and there would be an opportunity for a pre-identification. You know, when working in the hospital, because there is not a lot of automation, we're labored with a lot of paperwork and that kind of thing. It's hard to sometimes keep track of those patients. Even the best case manager loses track of who needs to be discharged, what are some pending denials. With the criteria right there.
What is it you're looking for from a hospital typically as you submit these requests for payment? What is the criteria they're looking at as far as reimbursement?
Great question. Time is money in any sector of healthcare, whether it be on the hospital side or whether it be on the payer side. They want clean, distinct, concise information that will allow that insurance company to research or to get approval for this particular patient. They want all the detail there with regard to why they are in the hospital, why they need an extension and length of stay, what diagnostics are being done. And when you have that information readily available, it not only makes the case manager's job easier, it makes the payer source's responsibility easier, because they can match the criteria to the information that you've been given, and ultimately you receive that approval of the claim.
So today, typically, are you seeing that case managers are given the priority, case management giving the priority that maybe feel they should, or is this an overlooked area of health right now?
I believe that case managers work very, very hard. It's a very significant part of the bottom line of a hospital and its budget, if you will. However, there are so many irons in the fire with regard to contracts and payer sources and the regulation and stipulation from the government entities as well as state entities, all those kind of lines of thought. It's very difficult for that particular segment of necessary and very valuable care to be overlooked. And I think it's come more to the forefront of the need of the hospitals today. But I think we've just put a Band-Aid on a gaping wound. Cases work very, very, very hard. And, you know, unless there's an adequate tracking system, things just fall through the cracks. I think this tool is going to be welcomed. I think it's very, very necessary, and I think it's very germane to the case management process. It'll simplify a lot.
All right, let's do it, Andrew.
I believe that's all the time we have for today's session. Thanks again to Andrea Frazier for joining us today. And as always, thank you all for joining us. We hope this webinar has informed you of the challenges case managers face and some of the ways you can meet those challenges. If you'd like to learn more about how Formfast can impact your hospital with our case management solution or any of our workflow solutions we offer, feel free to call us directly at 1-800-218-3512 to set up a personal demo. Once the number is 1-800-218-3512. You'll also be presented with a page following this webinar that will allow you to choose to set up an on-site visit with a workflow specialist, courtesy of Formfast, or register for our next free webinar. As I mentioned during our next online event, we're excited to debut the next generation of our workflow automation platform, FastFlow. There are many exciting features that are designed to transform your hospital processes that we can't wait to show you, so make sure to sign up for that. Thanks again for your attendance, and we'll see you at our next free webinar in November.